52-year-old Helga Christensen lives in Ormskirk near her son Daniel.
I'm very gregarious and outgoing when I'm well. I've travelled all over the world, I've scuba diving, I've done lots and lots of things. And it all stopped. Singing, dancing, everything stopped because the pain is too bad.
For 8 years, Helga has suffered from crippling headaches that paralyse the right-hand side of her body. Doctors recognise the condition, but there is no known cause. All they can do is treat the pain. A week ago, her doctors tried a new treatment, a nerve block injection, but it seems to have made things worse.
It's as though your skull is being crushed in a vice, and it's going to explode. You feel like your eyes, everything is just going to explode out. And it's like a tsunami of pain. You can't speak, you can't do anything. You're helpless.
Helga has come back to the Walton Centre, desperate to find out what's going on.
What I'm often aware of is that when we treat someone for one headache condition, we will settle that down and another headache condition will leak out. And I think what's happened here is we've switched it off, and I think you've leaked out into a different type of headache. And this headache disturbance looks more like cluster headache, which is generally considered to be one of the most horrific pain conditions known. The treatment we use for cluster headache is nerve blocks. Now, I know the last nerve block has turned off your hemicrania continua, and this other headache condition has now come on in its place. I'm not going to threaten you with that at the moment, but I think that's something to consider over the next week or two if we're really having difficulties and not controlling. So keep a diary, keep a very close idea on it, and I'll write your prescription for the sumatriptan.
Okay, thank you.
Okay.
Cluster headache is notoriously difficult to treat. For now, Dr. Silver gives her strong migraine drugs.
Okay.
If this is cluster headache, he knows it will come back.
Take care.
It's a week since Helga Christensen last saw Dr. Silver, and her headache has come back.
Helga Christensen. Hi.
Hi.
Nice to see you. Come on in, have a seat.
I can't move, I can't stand up, I can't sit down, I can't lie down, the light, everything.
Have you been through normal childbirth before?
Yes.
Yeah. So in comparison, was childbirth painful?
It was, but when I'm in full-fledged of this, I would rather have that.
Yeah. I know in the past we've done a nerve block, and this has happened since a nerve block. But one potential would be to try another nerve block procedure. And I don't know if you want to do that.
Oh.
Do you want me to do a nerve block on you now?
Yes, please, do something.
Okay. I'll just go and get the kit for you. If you just wait a moment, I'll go and get something.
Keep breathing. Breathe in. Hold it, and then out.
Helga has had this injection once before. It only offers short-term relief, and there's a limit to how many times it can be used.
I can't.
The nerve block is a combination of steroids and local anaesthetic that's injected directly into a nerve at the back of her head.
So just remind me, which side is the pain on?
Right.
Okay, so...
Dr. Silver must control the immediate pain before he can work out a long-term solution.
This isn't just about pain. I mean, cluster headache is a hugely debilitating, horrific condition. Generally, once you have it, you will usually have it through your life. So there will be spells when you're affected and spells when you're well. And for some people, they may have it on a regular basis long term. So it's a condition that's going to need managing for a long time.
It's a week since Helga Christensen had a nerve block injection for a severe headache.
Nice to see you. Come on through.
She's now having agonising attacks every day.
I'm a bit frightened that it's spiralling a little bit. Do you know what I mean? That it's... I need to find some way of sort of capping it. And I know you're trying your best to help me there.
Yeah,
and,
right. So I think we need to get a preventative strategy that has something to work quickly and something that will work a bit more slowly over time that we can build up. For 90% of people, a course of steroids will actually turn this off.
Right.
Very rarely people with steroids go a bit doolally on them and they start getting very depressed or agitated or, you know, even acting a bit strangely or even psychotic, seeing things. If you had anything like that, you stop it on that day. But it's extremely rare, especially in young people. The next thing that we do at the same time is start you on this drug, verapamil. So people with
Helga is entering a new phase of treatment. All the drugs they try now have risks attached.
None of these drugs are licensed for cluster headache. We don't have drugs that have been studied and studied to the extent where they have a license in the UK.
They're getting to the point where I literally would do anything. If you said anything, I would do it, try it, because I just have to get rid of this acute pain.
Bye.
The steroids worked for a few weeks, but the headaches came back, and with them a debilitating paralysis of her right-hand side. She's unable to walk or speak during the attacks and can't leave the house for days at a time.
I'm forever the optimist about this, and I will beat this. I know I'll beat it eventually. And in the meantime, I'll just carry on. And on the good days, I'll do what I'm good at, like today. And on the bad days, curl up in a ball and hibernate. And hopefully there'll be more good days than bad days.